Francella, thank you. Baseball's regular season is over, but of course now we're joining the postseason, and now a different process begins for many players involving the assessment of injuries. So this morning we are focusing on a common injury in baseball. Here to talk about the latest in elbow injury research is Scripps Clinic orthopedic surgeon and former Padres team doctor, Dr. Fronek. Good morning.
Good morning.
Thank you for being here. And of course we're talking about ulnar collateral ligament reconstruction, which if you're a fan of baseball, you know it as Tommy John surgery.
Right.
And this is got to be an expertise area for you, right? Because this is a big one in baseball.
It is. It is. It's one of those injuries that, unfortunately, it's pretty common in baseball, and it can be career, sometimes even career-ending injury. And so, actually, we've been interested in that for a long, long time, and more recently, I think one of the things that we've been doing is looking at the outcome of some of these operations that we're doing. You know, we were able to take a look at about 1,000 players, pitchers primarily, who had this kind of injury, and it's a big operation for many of them. You know, it takes about a year and a half to recover, and so on. And so one of the things that about half of those players did not have surgery, and they were treated with a variety of methods, everything with just a rehab program, and some of them had a PRP injection and stem cells, and so we wanted to see how those guys were doing.
And so now we're seeing a lot of advances being made in sort of the non-surgical treatment of these injuries. And the reason this is so important for our viewers listening is because so many of us send our kids into sports, and really the overuse of these joints, since we're starting our kids as young as 3 in some of these, you know, T-ball leagues and things like that, you really have to pay attention to how our joints are being used, right?
No, definitely. And, you know, especially in an area like here where you can play baseball year-round, you know, and so sometimes that the overuse is a real problem, basically, because, you know, especially if the child's pretty talented, they're playing rec league and travel ball, and they may play, do some showcases, and all of a sudden the workload really builds up. So, yeah, keeping an eye on that is really important. Actually, one of the things that I was fortunate enough to participate in, the commissioner's office has a website, Pitch Smart website, and there virtually every from I think 10 years of 10 years age to 22, there's some specific recommendations, and trying to mix it up a little bit. You know, you want to take at least 4 months off every year and play another sport. That allows the body, the shoulder, the elbow to recover, and the kids will get better at a different sport, and, you know, emphasize the athleticism rather than just playing baseball.
And you really helped develop some of these pitch guidelines for the MLB. What do you suggest, in addition to making sure that our kids take 4 months off? Do you suggest that you try other options, non-surgical options, before you were to enter into something like Tommy John surgery?
Well, I think, well, a couple of parts to that. Obviously, prevention's the best thing, and that's where I think cross-training, picking different sports. Just an aside, one of the things that we did, Todd Hutchinson, who was the head athletic trainer with the Padres, and we did a sort of an informal survey of the players, the professional players, and the coaching staff, and virtually all of them played professional baseball, and all of them played 2 or 3 sports in high school and college, except for the guys who came from Dominican Republic. So it's really important to cross-train. Working out, having a good coach, looking at the biomechanics is very important. And then with the surgery, you know, again, we looked at the professional players, and the non-operative program didn't turn out to be as helpful. 2 years down the line, almost 40% of the guys were still playing baseball. So it's not a very high success rate. So for that group, surgery may be a really good option. For the high school and college kids, it's a different story, and the success rate with the non-operative program in that group is much higher.
Dr. Jan Fronek from Scripps Clinic. I'm sure some great tips this morning, and parents can certainly check out more on the website there, Scripps Clinic.
Yeah.
Thank you so much for being here this morning.
Well,